Early adverse events and long-term outcomes of endoscopic sphincterotomy in a pediatric population, a single-center experience. Introduction. Endoscopic sphincterotomy, EST, has been widely utilized in adults to extract common bile duct (CBD) stones during endoscopic retrograde cholangiopancreatography, ERCP, since it was first introduced in 1974. EST is also performed to facilitate stent placement for biliary and pancreatic duct strictures, treatment of sphincter of Oddi dysfunction, and removal of obstructing pancreatic duct stones. Since the first EST for a 16-year-old child with chronic pancreatitis was performed in 1982, EST has been increasingly utilized in pediatric patients. However, EST is relatively invasive even in adults, and competence in ERCP with EST is developed through the accumulation of experience. ERCP is an advanced modality in the diagnosis and management of pancreaticobiliary disease in both adults and children. Because of its technical difficulties and the relative rarity of pediatric pancreaticobiliary disease, ERCP has not been frequently performed in children. However, a recent increasing trend in the volume of pediatric ERCPs has been noted in the United States. Although diagnostic ERCP decreased from 2000 to 2009 with the increased use of alternative modalities such as magnetic resonance cholangiopancreatography, MRCP, the total volume of pediatric ERCPs increased during that period because of the increasing number of therapeutic ERCPs. Successful cannulation of the requisite bile and/or pancreatic duct is necessary for successful therapeutic ERCP. Reported cannulation success rates are relatively high in our and other pediatric studies, and EST following successful cannulation is critical for the overall success of therapeutic ERCP. To date, EST has shown excellent results in facilitating drainage and stone extraction in pediatric patients with pancreaticobiliary disease. Because of their longer life expectancy, pediatric patients are at higher risk of late post-EST complications. While the performance of EST in children is increasing, to our knowledge, no studies have evaluated its long-term outcomes. This study evaluated the EST indications, technical and clinical success rates, short-term adverse events, and long-term outcomes of EST in children with pancreaticobiliary disease. Background and aims. The use of endoscopic sphincterotomy, EST, in the management of pancreaticobiliary disease in children is increasing. However, studies of long-term outcomes are limited in pediatric patients. Therefore, this study evaluated the early adverse events and long-term outcomes following EST in pediatric patients. Patients and methods. Cho et al. Retrospectively analyzed data from 198 pediatric patients who underwent ESTs at ISSN Medical Center Children's Hospital between 1994 and 2013. The median age was 8.7 years, range 18 months to 17 years. The authors evaluated the indications, success rates, early adverse events, and long-term outcomes. Results. Long-term information was available in 198 patients with a median overall follow-up duration of 42 months, range 1.8 to 232.1 months. Early adverse events, less than 30 days, following 294 ESTs among 198 patients, included pancreatitis in 17, 5.7%, hemorrhages in 6, 2.0%, sepsis in 3, 1.0%, and perforations in 2, 0.7%. Long-term complications, greater than 30 days, developed in 12 patients, 6.1%, including cholangitis with or without bile duct stone and minor papilla restenosis. The cumulative incidence rates of long-term complications were 3.1%, 6.1%, 9.3%, and 9.3% at 1, 5, 10, and 15 years. There were no procedure-related pancreaticobiliary malignancies or deaths. All adverse events and long-term complications improved with appropriate management. Conclusions. In pediatric patients with pancreaticobiliary disease, EST has a high level of technical success. In addition, pediatric EST showed low rates of early adverse events and long-term complications, which could be managed safely. Our results suggest that EST is a safe method for treating pancreaticobiliary disease even in the pediatric population.